This week's Ask Dr. Durie comes from a patient newly diagnosed and anxious to be sure if the correct selection has been made for that first choice of treatment. And so the question is, what treatment is recommended for a newly diagnosed patient? And so in 2022, there are actually just a few straightforward choices to be made. If a patient is in the category where transplant, autologous stem cell transplant is an option, and the patient is interested and willing to pursue that course, the standard therapy, the standard of care therapy, which is recommended, is the combination of Velcade, Revlimid, and dexamethasone, a triplet therapy, VRD. If the patient is living outside of the US, just to mention, sometimes the VRD is not available, then VTD or VCD can be used with thalidomide or Cytoxan, an alkylating agent, substituting for the Revlimid. For a patient who is not eligible or wanting to pursue transplant, the primary recommendation is to use the triplet of daratumumab, Revlimid, and Dex, DARA-RD. And this is the strong recommendation because of excellent results in terms of both response, remission length, and survival. So a very clear option in this non-transplant setting. Outside of the US, where the daratumumab combination might not be available, other combinations incorporating the alkylating agents melphalan and Cytoxan may be considered. What is quite important just to be aware of, particularly in the United States, is that the 4-drug combination in which daratumumab is added to VRD can also be considered as an emerging option. We still do not have full long-term comparative data to say that the remission and survival are definitely significantly improved, but this is a strong possibility as more data emerge. Again, outside of the United States, the combination of daratumumab with Velcade, thalidomide, and Dex may be considered because strong data are available for that combination from the trial called the Cassiopeia trial. And so, bottom line, there are some very simple options to be considered for initial therapy for a newly diagnosed patient. VRD in the transplant setting, and DARA-RD in the non-transplant setting. And so please be aware of this and talk these over carefully with your doctor if those will be feasible in your case, and if there would be some small changes or nuances that would be necessary to follow through with these treatments.